The first is people need to be clear about what their organization exists for, what the purpose of the organization is. Because, just being clear about the direction of our organization tells the 2,500, 3,000 people who work in the trust, okay, that's what this stands for. It gives them a sense of positive identity. It helps them understand where they should be focusing their energies and what their commitments are. So supporting our service users and carers, our staff and the communities we serve to live healthy and fulfilling lives, where we can all achieve our personal and professional goals and live free from stigma and discrimination. For sure, that would get me out of bed in the morning. It's inspiring, it feels very valuable, very important. And the three areas that you described, Sarah, felt really clear and really inspiring. But we also know this can't just be a bunch of words on the website. Because actually, if all it is a bunch of words on the website, but what the staff experience is their leaders just spend all their time talking about finances or productivity or the regulators, important though those are to talk about, if those topics trump this, then it undermines people's trust. So it means that as a leadership community, it's really important that what you're demonstrating every day, through your behavior, through what you talk about, through what you emphasize, through what you prioritize, is these issues, supporting service users and carers, the staff and the communities they serve to live fulfilling, flourishing lives, free from stigma and discrimination. And the second is that, as I said earlier, it's clear that people in NHS organisations are overwhelmed. So these national bodies are setting priorities. The board is setting priorities. Directorates and departments are setting priorities. And the people on the front line often just feel overwhelmed with all of this stuff. We've come to call them the priority thickets. There are so many priorities, you can't see clearly what's important anymore. Kind of ironic, isn't it? So, the role of leadership is to provide direction and then to ensure alignment, that everybody is aligned around that direction. And that means being clear about goals. So it begins with the executive team. So the executive team, all of the work we've done on team working over the last 30-odd years in the NHS has shown that the most important determinant of healthcare team effectiveness is whether they've agreed a limited number of clear, challenging goals aligned to the vision of the organisation, 5 or 6. And it begins with the executive team. So lots of the executive teams we talk to in the NHS, when we ask them, what are your team objectives? They say, well, we don't have team objectives. We've got the corporate objectives, that's what. But it's not your job to deliver the care. It's your job to support the organisation to fulfil its function. What are you going to do as a team, working together as a team, to deliver for the organisation? Because if the executive team hasn't got clear shared objectives, you get that kind of silo working, which prevents the organisation from delivering high-quality integrated care for people in the community. And that principle of ensuring that our teams have clear, agreed, challenging objectives should be spread through the whole organisation. So all of the work we've done with, for example, community mental health teams has reinforced that principle. So as a leadership community, it's really important that we are focused on agreeing with our teams, having the conversation with our teams to ensure they have 5 or 6 really clear objectives. And that those are aligned to the vision of the organisation.